Hello, everyone. My name is Alan Hudson, and I'm a shareholder in the Labor and Employment Group at Crow and Dunlevy. Over the next hour, we are going to be talking about the ADA and its interplay with COVID-19. I'm sure that each of you have dealt with some of these issues in 2020, and so we're going to, again, kind of do an overview of the impact COVID-19 has had on workplaces and the types of accommodations that employers are being asked to provide. I usually start off with a joke because, quite frankly, sometimes that's the highlight of my presentations, but there hasn't been much to joke about in 2020. So I'm not gonna tell any jokes today. While we don't have jokes, we are gonna have some polls that we want folks to participate in. And then, as always, please send any questions that you have throughout the presentation. We're gonna take 10 to 15 minutes at the end of the presentation to try to get to those questions. If there are any questions that have been asked that I don't get a chance to get to or just don't feel comfortable answering during this webinar, we will try to have somebody circle back with you and get you the answers that you're looking for at a later date. The ethics committee at the firm would have me tell you at this point that anything I say from this point forward is not legal advice, and that to the extent you have a specific question that you need a legal opinion on, please reach out to your outside or inside counsel. And as always, we're more than happy to provide those services to you. So the first poll that we want to have the crowd answer is, how many of you have dealt with an ADA issue related to COVID-19 basically since March of 2020. I suspect that a majority of you have, and well, it looks like right now it's looking like it's about 50-50. So the folks that have, I apologize for the headaches. The folks that haven't dealt with it, you might want to go to Las Vegas because you're certainly living right at the moment. So usually when we're talking about the ADA, and we've presented on this, numerous times over the years, and everybody I think that's attending this webinar has a pretty good understanding of the ADA and the related issues. But we always kind of talk about the triangle of death when you've got an ADA issue, right? You're always thinking about not only the ADA, but also FMLA issues and potential work comp issues. Well, COVID-19 has kind of presented some unique challenges, and there are other considerations that have to be taken into account in dealing with COVID-19 in the workplace. And one of the principal players that usually we don't think about when dealing with ADA issues is OSHA. OSHA has obviously been very active with respect to COVID-19 and has issued numerous directives towards employers, with the principal directive being that you've got to maintain a safe workplace for your employees. And so there has been quite a bit of an overlap because a lot of the administrative and environmental controls that OSHA is requiring employers to implement also kind of play with accommodations that certain employees have been requesting. And so again, don't just think about the ADA, the FMLA, and work comp. You also need to be considering OSHA and what implications that may have when you're dealing with these requests for accommodations. Because again, at the end of the day, your number one concern at all times, and especially during the pandemic, is the safety of your workers. And so that is something that's going to factor in when you are faced with a request for an accommodation. I do want to take a few minutes just to, again, do a kind of a brief overview of the ADA and the Oklahoma equivalent, the OADA, which prohibits discrimination based on disability, and also places an affirmative obligation on employers to provide an accommodation when necessary to allow an employee with a disability to perform his or her job functions. And so anybody that's a qualified individual with a disability is protected under the ADA and the OADA. I will say that the definition of disability has been so broadly construed that most physical or mental impairments that aren't transient, meaning they're permanent, are going to probably be deemed as a disability. And so if you're dealing with an individual that has a physical or mental impairment, then that individual may be entitled to an accommodation. I think one of the biggest misconceptions, at least initially, and I think some of this has subsided, is that if you got COVID-19 or you were afraid you're going to get COVID-19, that was a disability. And generally speaking, testing positive for COVID-19 is not a disability because, again, it's transient. It's not a permanent medical condition that is going to impair a major life activity. Now, obviously, there are certain circumstances where an individual, the symptoms are so severe that the person's hospitalized, for weeks or months on end. In those situations, actually having COVID-19 likely rises to the level of a disability under the ADA and the OEDA. But just generally speaking, if somebody just, is diagnosed with COVID-19, it'd be similar to the flu. That person does not have a disability. So that's what makes this a little bit difficult. What you're really looking at in tackling these accommodations issues is, does the employee have some other underlying condition like diabetes, anxiety, post-traumatic stress, that COVID-19 then is, increasing or impacting negatively that underlying health condition. So again, your focus in dealing with these accommodation issues isn't so much on, does the person have COVID-19 or is the person fearful of COVID-19? We're really focused more on, does the individual have some sort of underlying health condition that rises to the level of a disability, and COVID-19 is having some sort of adverse impact on that health condition. So again, don't get distracted or too focused on COVID-19. We're really more looking at what other health conditions does this individual have. We get questions all the time about, has COVID-19 changed how we handle regular ADA accommodations issues? And it hasn't. Once you're on notice, whether the employee tells you they need an accommodation or they're hinting that they need an accommodation, or maybe just your perception of how things are going, you believe they may need an accommodation. At that point, nothing's changed. Your obligation is to engage in the interactive process, to ask questions and gather the information necessary to determine, one, does the person actually have a disability? And two, if so, what kind of accommodation can we make to allow this individual to perform the essential functions of his or her job? So again, COVID-19 hasn't changed that. Once you've got some notice that the individual may need some sort of accommodation, you just go about the interactive process like you would have done pre-2020 when COVID-19 kind of changed all of our lives. A big thing that is coming up with respect to ADA and accommodation issues is confidentiality. And obviously, you have to keep medical information confidential. It does not need to be shared with coworkers. It can obviously be shared with management level employees that need to know perhaps that an employee has tested positive for COVID-19 or is having some other health-related issues due to COVID-19. Any medical information that you gather regarding COVID-19 on an employee, like, it needs to be kept separate in a separate file. It doesn't need to go in the personnel file. Again, just like any other health information, we're keeping that in a separate locked file where only certain individuals have access to it. And so again, if you're checking temperatures and you're keeping temperature logs, or if you're keeping, documents from medical professionals related to an individual's diagnosis of COVID-19 or related health issues, all of those things need to be kept in a separate file. Please do not include them in the personnel file. That can certainly lead to confidentiality breaches and get you in a little bit of hot water with the EEOC. And so another big issue is, like, what kind of accommodations are we talking about? And again, not much has changed here. I mean, the types of accommodations that may be required are allowing somebody to telework, allowing an employee to take leave when it's definite, meaning we have some idea of when we think the individual is going to return to work. You may need to have physical distancing in the workplace, where hopefully most of you, through OSHA's guidance, are social distancing as much as feasible within your workplace. wearing masks and face shields while at work in common areas or around people. Again, OSHA is really encouraging folks to do that. So it's probably something that you've already implemented, but that could be an accommodation. Alternating work schedules where you've kind of got folks on shift. That way you're keeping the number of individuals in the office down at any given time. That could be an accommodation. Physical barriers, when you go into a gas station now, you see the sneeze guards, those types of things that can also be utilized in your workplace to protect your employees. And then modifications to HVAC systems to the extent you need better airflow or things like that to protect your employees. Again, this is where the OSHA ADA overlap. A lot of these things you've already done, and these are the types of accommodations that employees have been requesting. Now that we've kind of done a broad overview of the ADA and coverage, again, I don't want to get bogged down in that because I know pretty much everybody attending this webinar is well versed in those issues. I want to do something a little bit different. Hopefully this will keep everybody awake during the lunch hour. But I initially want to just kind of talk about a real life scenario that I'm currently dealing with for a client. The client is in the restaurant industry, and they have multiple locations. And in December of 2019, they had a new hire who they found passed out in the restroom of the restaurant. And it became apparent that this individual had a latex allergy. So if she came in contact with anything that had latex powder, she would have a severe allergic reaction. And in this instance, she actually passed out. So following this incident, the employer decided that they would work with the employee to accommodate the latex allergy and began purchasing non-latex gloves for this individual to wear. And so this worked fine for a few weeks. However, her allergic reaction was so severe that if she even touched the surface that another coworker had touched with latex gloves, she would have a reaction. So this happened a couple times where they actually had to send her to the hospital because of the severeness of the reaction that she was having. So from there, the employee requested, and this is about in March when we start having more issues with the individual. And obviously March, the middle of March or so is when everybody's lives changed due to COVID. And so because her allergy was so sensitive, she requested that everybody in this restaurant location wear non-latex gloves. In normal circumstances, that's probably a pretty reasonable accommodation, not going to create any type of undue burden on the employer to purchase non-latex gloves for all of the employees working at that location. However, because of COVID-19, it became very difficult and almost impossible to purchase non-latex gloves. This client looked online through Amazon. They were going to wholesalers. They just couldn't get the gloves. And when they got the gloves, it was taking 2 to 3 weeks for them to be shipped. And so you'd have a 2 to 3 week period where this employee was potentially exposed to latex and was going to have an allergic reaction. And so they sent her home for a little while as they waited for the gloves. But as this progressed, it became very obvious that they weren't going to be able to purchase enough gloves and get gloves quick enough to actually accommodate this individual's latex allergy. Eventually, because she continued to have adverse reactions and because the employer was concerned that this individual was going to, pass out and hurt herself or hurt someone else, and given the fact that they could not get non-latex gloves, the employer made the difficult decision to terminate the employee. The employee has filed a charge with the EEOC claiming disability discrimination and retaliation. We have filed our position paper, and really our arguments are twofold. One, we're arguing that her allergy to latex is not a disability because, again, it's not a permanent thing, and in fact, she only has reactions when she comes into contact with latex. So again, it's a transient medical condition. And then two, we're arguing that her request placed an undue burden, or basically an impossible burden, on the employer because of COVID-19. They've not had the ability to get the non-latex gloves. They're back ordered, and quite frankly, most of these gloves are going straight to healthcare facilities, and they're just very difficult to get your hands on. So it really has raised some unique questions with respect to the interplay of COVID-19 and the ADA. And I think there are going to be many more of these types of cases brought here over the next year or so. And what's really important to remember in handling these accommodation requests is that the EEOC is really taking a hard look at these types of charges and these types of claims of failure to accommodate, given, as it relates to COVID-19. So if you're faced with these accommodation issues that we're going to talk about, you need to really take them seriously. You need to be deliberate, because again, any charge that gets brought is going to get a little bit of extra attention from the EEOC. So that's kind of the real life example that I have that I'm dealing with for a client right now. And we'll see how it plays out. Again, I think that our arguments are solid, and we should get a dismissal without cause. But again, I suspect that the EEOC office is going to take a longer look at this situation because of the uniqueness of it and the fact that we're living through a pandemic. So I want to switch, since we're talking about the EEOC, I want to switch gears a little bit and talk about how the EEOC is handling COVID-19 and the type of guidance that the EEOC is providing employers. And really, this is a little unusual, but I just kind of want to go through a list of questions and provide answers, and then we can, I'll elaborate where I feel it's necessary. The first question, can an employer ask an employee about whether or not they're suffering symptoms of COVID-19? Pre-COVID-19, pre-pandemic, if one of you picked up the phone and you called and said, Alan, I really want to ask an employee or all of my employees certain medical related questions to determine what symptoms, if any, they have of a medical condition. My answer to you would be no, we're not going to ask any medical related questions. You're skating on thin ice and potentially have ADA violations. However, we're living in a different world, and because we are in the middle of a pandemic, the EEOC has made very clear that employers are permitted to ask employees whether or not they're suffering from COVID-related symptoms. Now, that doesn't mean you need to be asking folks if their back hurts or why they're limping into work, things like that. It still needs to be symptom-based and related to COVID. So yeah, asking somebody if they've got a temperature, asking somebody if they've got a cough, if they've got a runny nose, if they've got fatigue. Those are the types of things that the EEOC has made very clear that during this pandemic, employers are allowed to ask those types of questions. Now, again, once we get past this pandemic, don't think that you can continue to ask those types of questions. We're going to be back to the old days where you're not making medical inquiries without a good faith, objective basis to do so. So again, as we sit today, you can ask employees about their symptoms. You can also take employees' temperatures. I know that this was a big thing that our clients were implementing kind of during the height of the pandemic, and the EEOC has made very clear that given the world we're living in, you can check an employee's temperature. What if an employee refuses to allow you to check their temperature, or if an employee refuses to answer questions that you may have related to symptoms? What type of discipline can you take with respect to that employee? Again, the EEOC has made very clear that if an employee refuses to submit themselves to a temperature check or to answer symptom-based questions, you can tell that employee to go home as discipline, and to the extent there's a continued refusal, you can terminate the employee for insubordination and not be in hot water with the EEOC. Obviously, if you've got an employee that has been exposed to COVID-19 or has tested positive for COVID-19 or has symptoms of COVID-19, an employer is certainly free to send that employee home without running afoul of the ADA. And quite frankly, if you didn't send the employee home, you may have issues with OSHA. So again, keep in mind during this pandemic, the number one responsibility of each of you is to maintain a safe workplace. And so the EEOC has come out and said, yeah, we understand that. And to the extent you have to send employees home, you're not going to have any ADA related issues from their perspective. That doesn't mean that you won't have a disgruntled employee that, runs out and files a charge, but the EEOC saying you're on steady ground in making those decisions. You can also ask if somebody's been exposed to COVID-19 without running afoul of the ADA. One kind of tricky issue is, can you ask an employee if any of their family members have COVID-19 or symptoms of COVID-19? You cannot ask that specific of a question with respect to family members. You could run afoul of the Genetic Information Non-Discrimination Act, GINA, again, if you're asking specifically about family members. And instead, just make the question more broad. Have you been exposed to anyone that has COVID-19 or symptoms of COVID-19? And asking it in that manner is okay. And again, you're not going to run afoul of the ADA, but just don't specifically ask about family members. Can you ask employees where they've traveled? Again, yes, in this, the world that we're living in, you certainly can. That's not really as much an ADA issue as it could be a kind of a national origin discrimination type issue, but the EEOC has come out and said you can ask employees about where they've traveled. Can an employer, we got this question a lot early on, can an employer disclose to a public health agency the identity of an employee that has tested positive for COVID-19? And again, these are always raise confidentiality concerns, HIPAA concerns, ADA related concerns, and the EEOC has come out and made very clear that you can disclose an individual's name to a public health agency, and you are not going to run afoul of the ADA, and you're not going to run afoul of HIPAA either. So yes, you can make those disclosures. Now, what you can't do is make those types of disclosures wholesale within your workplace. So say you've got an individual employee that tested positive for COVID-19, this individual notifies HR or their supervisor. That information does have to stay, the identity of the employee and the related COVID-19 information has to stay confidential. Again, we're keeping this in a separate file, in a separate locked file cabinet, and not intermingling it or commingling it with the personnel files of the individual. You can tell management level employees that need to know. So if the direct supervisor hadn't been notified, you can tell the direct supervisor, hey, John Smith tested positive for COVID-19. We're letting you know as part of our investigation to determine who came in contact with the employee. Now, when you're talking to the employee's coworkers, again, do not disclose the individual's name. It needs to be more generalized. Hey, there's a coworker that you routinely work with that has tested positive for COVID-19. We just need to determine if you have had any contact with the employee within the last, whatever the time period is. Now, I get it. Those folks are smart. They're going to understand that John Smith hasn't been to work and probably figure it out on their own, and that's fine. But what you can't do as the employer is disclose John Smith's name, because John Smith may later argue a violation of your confidentiality responsibilities and bring a valid ADA claim in that situation. What I've been advising folks to do, and haven't had much pushback from employees, just ask John Smith when he tests positive, hey, do you mind if we disclose to your coworkers that you were the person that tested positive? We need to do an investigation and get folks out of the office or the workplace if they've come in contact with you. And 9 times out of 10, the John Smiths of the world are going to say, sure, yeah, I want my coworkers to be safe. You are fine to disclose my identity to them when you're asking them questions. If you can get that in writing, great. If you shoot John Smith an email, hopefully he'll respond. If you don't have it in writing, at least make a note in your investigation notes that John Smith consented to you disclosing his identity. That way, if it ever becomes an issue on the back end. But without that consent, again, you need to keep John Smith's name confidential and only disclose it to employees that need to know. Generally speaking, that would be management level folks. One other good question is an employee entitled to an accommodation to protect a vulnerable family member? So we've been dealing with this quite a bit, where you've got an employee who lives with their grandparents because they're providing care on the side, or they're living with an elderly, mom or dad, or they've got a cousin that's moved in because the cousin has a disability, and these employees are concerned that they may contract COVID-19 in the workplace and then bring it home where they've got a vulnerable family member living with them that they are trying to protect from getting COVID-19. And you do, the EEOC has made clear, you do not have to, under the ADA, make an accommodation to an employee that is only worried about passing COVID-19 on to a vulnerable family member that is living with them. Again, you are focused more on, does the employee have an underlying health condition that rises to the level of a disability that would require the employer to provide some type of accommodation. Now, while you don't have to provide an accommodation, you still are prohibited from discriminating against this employee for making that request or disclosing that they've got a family member that has a disability. And so again, if John Smith came to you and said, hey, look, I live with my grandparents, they're elderly, I'm worried about contracting COVID-19 and passing it along to them, so I want to telework, you do not have to provide John Smith the accommodation of teleworking, because again, he does not have an underlying health condition that's protected under the ADA. What you can't do though is say, John Smith, great question, really can't believe you're dumb enough to ask that out loud, you're fired. That could be a violation of the ADA because it looks like you're discriminating against John Smith based on his association with a disabled family member. So again, don't have to provide the accommodation, but you can't retaliate, harass, discriminate against the individual for asking for the accommodation. Can an employer require an employee to wear protective equipment in the workplace? So this has become a big source of controversy, and it's somehow become very politicized, where at least the media is telling us that anybody on the right is kind of against wearing masks and everybody on the left is all about wearing masks. I'm not sure that that's entirely accurate, but there has certainly been pushback in the workplace with respect to employer mandates requiring employees to wear masks. OSHA certainly says you can require an employee to wear a mask, and quite frankly, they're encouraging it. I know in our office, if we're in a common area, basically if we're not at our desk, we have to have our mask on in the office. The only reason they let me take it off for this is so that you can understand what I'm saying. So yeah, the EEOC came out and supported OSHA, said yes, employer, you can require employees to wear protective equipment, mask, face shield, gloves, those types of things without running afoul of the ADA. But we'll talk about a little bit later what happens when an employee comes to you and says, hey, look, I have trouble breathing because I have asthma, or I have really high anxiety, and wearing the mask compounds that, and so I don't want to wear the mask. Now, in those situations, yeah, you probably are going to have to engage in the interactive process and decide, is there something else we can do to accommodate this person's underlying health condition that makes it difficult for him or her to wear a mask in the workplace. But just the overarching kind of rule from all this is, yes, an employer can require protective equipment in the workplace. Can an employer exclude a pregnant employee from the workplace because the employer is concerned that if the pregnant employee gets COVID-19, that may create some sort of health complications for the employee? And the answer is no. You can't make those kind of sweeping maternalistic type decisions where you're excluding somebody. You feel like you're doing it for their own safety. But if you're excluding a pregnant person or an older person or somebody that you believe has a disability, those types of situations are going to get you in trouble under the ADA and the Pregnancy Discrimination Act and Title VII generally. So again, I understand that your heart may be in the right place and that you feel like you're doing this to protect the health and well-being of your employees, but you can't just unilaterally make that decision. If that's a decision that's reached between you and the employee through the interactive process, fine, but you can't wholesale make that decision on your own without getting yourself in a little bit of hot water. And so again, we've gotten a lot of questions like that over the last few months, really since the middle of March, with respect to how do you protect your employees and your vulnerable employees. And again, you just can't unilaterally make those decisions because a lot of folks are ready to come back to work. Quite frankly, they want to be back at work because they're tired of being cooped up at home. I always kind of liken it to over the years, we've had clients that have had individuals that suffer workplace injury after workplace injury, and employer fires the employee. And when we ask them, well, why'd you fire them? So, well, we just felt like they'd be safer if they worked somewhere else because they continued to get hurt in the workplace. And if that's the answer, you're probably going to be opening your checkbook and writing a settlement check because that's not a great defense. The same's true here. If you fire somebody or you send somebody home with against their will and they're ready and willing to come back to work, and your defense is, well, that person was pregnant, or that person was 65, or that person has diabetes and asthma, and tick off whatever underlying health condition you can think of. So we send them home or we fire them. That's not going to be a good defense. And again, you're going to have to open your pocketbook a little bit and write a settlement check. I think I've generally covered what the EEOC's position is. Obviously, if you want to go to the EEOC's website, they've got some great resources for employers on how to handle certain accommodation issues as they arise in the workplace. Now I'd like to go to a few of the examples that we've got, and we've got some polling questions. And after we do these, it looks like I've got 5 questions. We'll turn to the Q&A. So again, if anyone has any questions that they would like answered that have come up during the presentation, please continue to send those in, and we will try to get to them the last 10 to 15 minutes of the presentation. So this first scenario, and I'm actually going to read it if I can find it here. Okay, it's up on the screen. And so we'll have a poll that we'll have you guys participate in after we read this. So Tom is a healthy 30-year-old male who, prior to the pandemic, frequently participated in half marathons and triathlons. Tom is afraid of contracting COVID-19 and has asked to work from home. So Tom is basically the opposite of me. He's a 30-year-old who likes to run in half marathons and triathlons. So we're going to poll the audience real quick. Who thinks that Tom's covered under the ADA? Yes or no? Okay, we've got a lot of really smart students. So most folks are saying that he's not covered under the ADA. And I would say that based on this kind of general scenario, that Tom is not covered under the ADA. Tom's 30, he's healthy. He has no underlying health conditions. He essentially has just raised a concern that he's afraid of contracting COVID-19. And we've dealt with a lot of these issues. I bet that most of the folks attending this webinar have dealt with these issues where you've had an otherwise healthy employee come to you and say, hey, I want to work from home because I'm scared that I'm going to get COVID-19. In this scenario, again, because Tom has no underlying health condition, I do not believe that he is covered under the ADA, and I do not believe that you would have to provide Tom a reasonable accommodation. Now, if we change this scenario up a little bit, where Tom comes to you and says, hey, I'm dealing with high anxiety, or I have asthma, or some other health condition that makes Tom concerned that if he catches COVID-19, it's going to have a severe an adverse reaction for him health-wise, then in that situation, you probably are on notice and do need to engage in the interactive process to determine if you can come up with a reasonable accommodation. But again, just the fear of catching COVID-19 alone is not a disability. And so, Tom, if that's the only facts we're looking at, Tom's not covered under the ADA. So that's kind of the legal perspective with respect to this scenario. But from a practical standpoint, it probably is good to work with Tom as much as possible and try to alleviate the concerns that Tom has. And so again, from a legal perspective, you probably could tell Tom to go fish. From a practical, keeping a good employer-employee relationship with Tom, it's probably worth at least having the discussion with him to see if there is something that you can work out to where Tom's concerns are addressed, but you're also not, bending over backwards or putting, your business or your employees in a bad position by allowing Tom an accommodation. So again, I think most of us were on the same page there. And again, Tom, if you change the facts up just a little bit, Tom may be protected. So again, you got to be very deliberate and thoughtful in addressing these issues. Okay, Stephanie, can we switch to the second scenario? And I'm going to see if I can put so here's our second scenario. Tina is 64 years old. She has prediabetes, arthritis, and high cholesterol. Presumably we know all of these things because she's told us through other interactions that have come up over the years. She's not, and she tells everybody how she's feeling. You're developing a plan to return part of your workforce to the office to better serve customers. Tina has declared she is excited to get back to the office. Working from home is for the birds. You're concerned about Tina given her age and health conditions. And so let's get the poll question. And it's basically, should you engage in the interactive process with Tina? What does everybody think? Okay. We're kind of getting 50-50 results on this, which is not unexpected. My advice, I guess I'm not giving legal advice, I'm getting bad looks from the other folks in the room. In this scenario, I do not believe that the employer is required to engage in the interactive process. Tina has not come to you and asked you for any type of accommodation. You would be basing that solely on the fact that she has these health conditions and you're trying to protect her based on her age and again, the underlying conditions that she has from contracting COVID-19. So again, I do not think that you have an affirmative obligation to engage in the interactive process, and you could allow Tina to come back to work because Tina wants to come back to work. Now, presumably, you've already implemented some administrative and environmental controls that are going to help protect Tina, but that are applicable to all coworkers, such as social distancing, wearing masks, physical barriers, alternating work schedules, those types of things. So you've already got those administrative and engineering controls implemented to protect your workforce, including Tina. Now, if you wanted to have a conversation with Tina, I think you could without violating the ADA, but that conversation would need to be in generalized kind of broad terms. Tina, how are things going? Tina, what's your outlook on COVID-19? Tina, do you have any concerns about returning to work? And if Tina says, no, I'm ready to work, I'm tired of being at home with my grandkids, they're driving me crazy, then you got to let Tina come back to work. And if again, you unilaterally say, Tina, you can't come back to work because you're old and we're worried about your health condition, then you're going to be in violation of the ADA and the ADEA, the Age Discrimination and Employment Act. And so again, you can't unilaterally make those decisions for your employees, even though you've got their well-being at heart. So let's go to the third example. which I think gives us two questions. Masks have become an issue at work. In keeping with CDC and OSHA guidelines, as well as a local city order, you require your employees to wear masks at all times while at work. Again, we talked about that. OSHA allows you to do that, and the EEOC allows you to require masks. Jacqueline has been seen with her mask off a number of times, and coworkers report to you that she says wearing a mask is a matter of choice. So can we do the first poll question here? Is Tina, I think the question is Tina protected? Are there any other, I'm sorry, I'm saying Tina, Jacqueline. Are there any ADA concerns with respect to Jacqueline? So if you guys want to go ahead and start answering that question, and we're kind of answering them both, and that's fine. So with respect to Jacqueline, there are no ADA concerns. We are unaware of any underlying health condition that would make it difficult for her to wear a mask. She simply refuses to wear a mask in the workplace. So Jacqueline, again, could be disciplined for violation of your policy that requires a mask in the workplace. She certainly is being insubordinate in ignoring and or refusing to follow a workplace policy that you have implemented to protect your workforce. And so, yes, Jacqueline, again, no underlying health condition, can be disciplined. Now let's go to the second part of this scenario. The same day you learn of Jacqueline's noncompliance, Tom also comes to you and says that he feels like he can't breathe in his mask, and he feels like it is exacerbating exacerbating his asthma. Okay, so this is completely different. Who thinks that we need to engage, or there are ADA concerns with respect to Tom? And I think that through the polling, a majority of you said that there are ADA concerns, and you are correct. Tom has put you on notice that he may need an accommodation from a workplace policy that you've implemented. Here, that workplace policy is a requirement that he wear a mask. And so at this point, you and Tom need to sit down and go through the interactive process, gather the information that you need to determine that he does in fact have asthma and that wearing a mask is somehow exacerbating it. And again, that is just the normal course of how you would handle any ADA issue. Now, what kind of accommodations can we provide Tom? You know, maybe he can't wear a cloth face covering, but he could wear one of those plastic face shields that you see some people wearing. That may be one way to accommodate. Maybe you could isolate Tom away from coworkers where we've put him in an office in which he doesn't have to interact with his coworkers. That could be an accommodation. Maybe we, alternate schedules, or we put up physical barriers around Tom so that, again, he is not exposing coworkers to COVID-19. So those are the types of things that you would need to determine if you could accomplish to accommodate his request to deviate from your policy of requiring masks. So I hope everybody, those are the three scenarios that I really wanted to cover today, and hopefully those answered some questions. And again, based on the polling, it appeared that everybody was pretty much on the same page and had the same understanding of what your obligations are. I want to jump now. We've got about 15 minutes, and it looks like I have 9 questions. I'm going to try to jump into some of these questions. Again, there may be some pauses here as I read them to determine if it's one that I want to try to answer during the webinar, or if it's something that we need to save for later. Again, I'm not allowed to give you legal advice, so that's going to dictate a little bit which questions I answer. So the first question is, can you keep electronic versions of doctor's letters for COVID accommodations without having physical copies? Yeah, you can certainly keep an electronic version of a doctor's letter. And I know that given the fact that a lot of doctors' offices do not want their employees to come in, that they are doing, televisits, and they're, providing prescriptions or doctor's notes via email. And so you can keep an electronic version of those doctor's letters, or you can just print it off and have the hard copy. But the bottom line is you have the same confidentiality concerns. And so if you are going to keep an electronic version, you need to make sure that it's password protected, that it's in a separate file, and that only folks that need to know have access to that electronic copy of the doctor's note. If you can't ensure that you can maintain the confidentiality, then I would suggest that you do it old school and print a copy off, put it in a locked file cabinet where only folks that need to know that information have access to the key. But yeah, there's nothing that would prohibit you from keeping an electronic copy if you can maintain the confidentiality of the document. So that's the first question. That is a good question. I'm going to read a couple more here real quick. So again, I apologize for the delay and the pause. So the question is, I understood that the name of a staff that tested positive with COVID-19 could not be revealed to the immediate supervisor. Is this correct? The information related to the immediate supervisor is that a member of their team has tested positive, and that all information and contact tracing will be done by a member of the HR department. Is that a good practice? So I guess this is twofold. You can reveal the identity of the individual to the immediate supervisor. The immediate supervisor is someone that I would call, or is a person that needs to know that. I mean, one, they need to know it so they know that John Smith has a valid excuse for not coming to work because this individual is going to be sent home for 10 to 14 days. And you also need to tell the supervisor, because you, as part of your investigation, you may need to talk to the supervisor about who John Smith came in contact with during his last, couple of shifts at work. And so, yeah, to answer your question, you can tell the immediate supervisor. That would be a need to know management level employee. Now, you don't have to tell the supervisor. And obviously, the less that you disclose, the better off you are. So in this scenario, the individual that asked this question said they basically are just telling the supervisor that a member of the team tested positive without disclosing the individual's actual identity. And so you can handle it in that manner if you feel more comfortable doing it that way. But I do not believe that you'd be running afoul of the ADA if you disclose the individual's name to the supervisor. Okay, thank you for that question. I'm moving on to the next one. Okay, so this is a little bit long, and I think that I can answer this. We have a leader who's questioning what I believe to be a reasonable medical request to continue teleworking because their children are in public school and a couple of other micro schools are also closed and the daycare is closed. The employee may be occasionally in public spaces with strong physical distancing, cautious measures that aren't available to the employee within the workspace. I believe that we should assume good intent, question without assumption if there are activities that seem grossly in defiance of their restrictions, but otherwise that we absolutely should accommodate in good faith and watch out for retaliation from those perceptions. Can you please weigh in? So here, under the ADA, I don't believe that this individual is covered because, again, there's no underlying health condition. This person essentially wants to continue to telework because their children are, not in public school full time or the daycares are closed, those types of things. Now, obviously, in this situation, you may have some FFCRA issues that are outside the scope of what we're talking about. So, be mindful of that. They may be entitled to some sort of paid leave due to a school closure if they've not already exhausted that leave. But from an ADA perspective, no, I don't think that you would have to continue to allow this individual to telework under the ADA. Now, again, that's the legal side of it. From a practical perspective, yeah, I think you should probably try to work with your employee. Again, it's good for employer-employee relations. It sounds like this individual has good faith reasons for needing to stay home. It sounds like the person's been teleworking, and presumably that setup has been useful for both the employee and the employer. So yeah, again, from a practical standpoint, sure, work with the employee where possible. But if the employee starts claiming, well, this is some sort of disability discrimination, I just think that's hogwash, and the employee doesn't probably have a viable claim for disability discrimination. Okay. As we move into flu, that was a good question. I'm going to move on to the next. As we move into flu season, can you talk about, oh, I lost my question. Oh, can you talk about appropriate precautions with COVID when flu symptoms are so similar? Yeah, this is going to be pretty difficult, right? And a lot of the symptoms are the same. And quite frankly, having a common cold allows for a lot of the same symptoms of COVID. Given the fact that we are still having, strong numbers and that a lot of, well, in Oklahoma especially, I think we're a top 5 state per capita for positive tests. I think that you're going to have to assume that if somebody has a symptom that may be related to the flu, but it's also a symptom of COVID, that you're going to have to be sending these folks home. They're going to have to be getting tested to determine that they do not have COVID-19. And again, I've not seen any guidance otherwise. And I think OSHA is going to still be on employers to ensure that folks with symptoms are not permitted in the workplace until they have quarantined for the 10 to 14 days, depending on if they tested positive or they were just exposed to it. So it is going to create some headaches because you are going to have folks with runny noses that could just be from a change in temperature, a common cold, or they actually have the flu. But until you've confirmed that they don't have COVID, I think you're going to have to send them home and assume that they do to protect your workplace and to ensure that you're not running afoul of OSHA. Let me see. I've got maybe a bit off topic, but how could possible workplace exposure turn into a workers' compensation matter? Unfortunately, the Workers' Compensation Commission, to my knowledge, in Oklahoma has been relatively quiet on how they're going to handle claims that an individual contracted COVID in the workplace and therefore they're entitled to workers' compensation benefits. What I suggest is, though, that if you have a strong belief that, or some sort of objective evidence that the employee potentially contracted COVID-19 in the workplace, that you go ahead and notify your work comp carrier and let them handle processing the claim. Let them handle determining whether or not this is actually covered. So a good example of a situation in which work comp may be triggered would be a situation, maybe you've got a shift of employees where 5 of them have tested positive and they only see each other at work. They don't hang out outside of work. They're not related. That's a situation where I think you've probably got pretty good evidence that at least some of the employees contracted the COVID-19 virus at work. So that certainly is a situation in which I think work comp could be triggered and the employee could be entitled to those workers' compensation benefits. So I guess the lesson here is don't roll your eyes and automatically assume that the employee doesn't have a valid work comp claim. Again, best practice would be to report it to the carrier and let them deal with it to determine if it's actually a compensable work-related injury. Okay, so here's a great question, and I think a lot of folks are concerned about this, and quite frankly, I was concerned about it as well, and I do think it's going to create some headaches for folks moving forward. But here's the question. If we allow an employee to telework during the pandemic as an accommodation to their medical condition, and they request to continue working from home after the pandemic, and there have been no performance issues, will we be allowed to deny this accommodation in the future? And the answer is yes. A lot of employers, especially in Oklahoma, have resisted this change in the work dynamic where employees telework, or primarily telework. If you go to the East or West Coast, this has been a big thing and continues to be a big thing. But folks in Oklahoma, for the most part, have resisted allowing telework. However, because of the pandemic, a lot of employers that previously resisted allowing telework have allowed employees to work from home because that was just the only option. And so, yes, moving forward, once we get through the pandemic, outside of there being some underlying health condition or accommodation that needs to be made, you can say no more telework. And we've had a lot of employers that have done this since COVID-19, you know, kind of dipped there in the middle of the summer where they required their folks to come back. Now, what I will say is that having allowed them to telework previously may make that a reasonable accommodation in some sort of future scenario where you've got somebody that has some other disability and they need an accommodation. It may be more difficult to argue that teleworking is unreasonable because you were able to do it for a 6-month period in 2020 without much of a hiccup. So broadly speaking, no, you don't have to continue to allow the accommodation. However, given the fact that you have allowed folks to telework, it may impact your ability to deny a future request to telework when it arises. Hopefully that answered that question. So would you recommend accommodating pregnant individuals who ask to be transferred to another department unit within a hospital setting due to COVID? As a hospital system, we have decided not to accommodate because we cannot guarantee anywhere they work within the hospital that they won't be in contact with COVID. Okay, so simply being pregnant is not a disability. You are not disabled because you're pregnant. Now, you may have a medical condition that's related to your pregnancy that would result in a disability. Say hypertension is a good example where you've got an employee that's had an increased blood pressure. So to answer the first part of the question, you would not have to accommodate that individual under the ADA because they don't have a disability. Under the PDA, you may have to allow that person to transfer if you've allowed other employees that have similar health conditions, obviously not pregnancy, but have similar restrictions due to some other medical condition. If you've allowed them to transfer because of concerns of COVID, you would have to allow the pregnant employee to transfer because of COVID. So right under the PDA, again, you got to treat a pregnant employee just like you would any other employee that has some similar impairment. And so, yeah, I think that you're on solid ground to deny that request, and you're not going to run afoul of the ADA. If the employee does not want you to share their name, then how do you know if they had contact with coworkers within 6 feet and for over 15 minutes? So I think the practical response to that is when you're interviewing the individual that tested positive, you're asking that individual, who have you been in contact with, within the 6 feet for over 15 minutes, and they are going to identify for you the folks that they believe they came in contact with. And then also, because you can disclose the individual's identity to the direct supervisor may also be able to identify folks that this infected employee came in contact with. And so you have some ways to get the information. Again, in a perfect world, they're going to provide you, they're going to allow you to provide their name to coworkers, and so you're not going to have to deal with that issue. But if they won't, then you just got to really ask them specific questions about who they came in contact with, so you can then go notify those individuals that they may have been exposed to COVID-19. Is the organization or the HR department obligated and responsible for doing contact tracing? So this under the ADA, no. Under OSHA, probably. Yeah, I think that OSHA, as part of you maintaining a safe workplace, if you have knowledge that an individual tested positive, I do think that at that point you would have an obligation under OSHA to do an investigation to identify any individuals that person may have come in contact with, so they can be sent home for the 14-day period, or at least so they can be sent home for testing to determine if they have in fact been infected. And so again, yeah, I do believe that under OSHA, You have an obligation to do contact tracing. You also, under OSHA, have an obligation to clean any areas in the office in which that employee came in contact with. And those are the types of questions that you're asking again when somebody tests positive. Who have you been exposed to, within 6 feet for 15 minutes or more? What areas of the office have you been to? What areas or surfaces have you touched? And you need to be cleaning those areas to ensure, again, that you're doing everything that you can to prevent the spread of COVID within your workplace. Folks, we're at 1 o'clock and we're trying to be respectful of your time. So we're going to go ahead and end the webinar. There are several more questions that I didn't get to, and I apologize. I will try to reach out to the folks that I have contact information for. If you've not provided contact information and you want your question answered, please reach out to our marketing folks, Stephanie Turner, and she will get those questions to me and I'll get them answered. Again, I appreciate everybody participating. I know that this is a little unusual for everyone, and we'd prefer to all be in person at our client seminar, but hopefully in 2021 we can get the band back together and do this in person. Everybody have a wonderful afternoon. Thanks.